Hi everyone, this is Monte Hueftle, and I'm going to talk to you today about the three-pronged lifestyle approach. I'm talking to you about incorporating a lifestyle approach that is going to allow you to live with TMS. Live with TMS without the pain and other symptoms. Now this may be a profound shift for many of you in how you are presently treating your disorder. The TMS disorder is always going to be with you. That's the way we are wired. It's part of our makeup, and this is truth. Our objective is to live free of pain and other nervous system symptoms. Understanding and accepting this truth is a big, huge psychological improvement in healing from this disorder. You can now begin living your life versus treating a disorder to become pain-free so that you can start living your life. Get that truth. Digest that and let it sink into your consciousness. I was watching a TMS doctor's video the other day, and he was describing the right and left side of the brain functioning and talking about your inner childness, etc. Let me ask you a question. Does understanding brain function have anything to do with reversing this disorder? No, it doesn't. Does reading or being told that you have deeply repressed emotions help you reverse this disorder? No, it doesn't. So I want to get your focus. I want your attention, your energy to be on the one area that can affect change, and that is the cause. So if you're ready to accept that you are going to live the rest of your life with TMS, but, and this is a big, huge but, live without the pain and other symptoms, then you will be self-inspired every day to begin incorporating the three-pronged lifestyle approach into your life. And you will find it to be the most effective, efficient, and as permanent of way to live with this disorder, symptom-free, as there can be. So to get started, let's keep it simple. Right brain, left brain science, who cares? Study that stuff when you're symptom-free, not when you're still stuck in this disorder. Deeply repressed emotions that require years of psychotherapy to heal, only to find out that you still have TMS pain symptoms? Listen, the only way to treat deeply repressed emotions as they pertain to TMS is to do it now in the present moment, where you can address the way you are still repressing them with your daily thoughts and behavior patterns. You are living with TMS because it is a cause and effect disorder. You are generating inner tension with your daily moment-to-moment behaviors and thoughts, and you are repressing emotions. Yes, even deeply repressed emotions with your daily moment-to-moment behaviors and thoughts. In our theme of keeping it simple, it is our chronic daily patterns that are the cause of TMS, and your job, your work is on changing that cause, period. The more you get wrapped up in this big, huge TMS disorder, the more you stay trapped in the pain strategy. So we're going to focus our attention, our energy, on where we can affect change. And that is our daily moment-to-moment behaviors and thoughts that are communicating inner tension to our nervous system. Once our nervous system has received this inner tension, the automatic process of oxygen deprivation has started. We're not going to control the effects. It's already taken place. Our body is now receiving those effects. And it is either pain, tightness, unflexible, closed-offness effects, or it is open, flexible, and free effects. Remember though, we get to choose the quality of that inner tension that's being communicated. So people say to me, I know that I worry and strive to perform, and I want to please others, and I want to be good, and I know it's TMS, but it's not working for me. And I want to tell you, it is working. This disorder of cause and effect is working perfectly. You are communicating big, huge inner tension, and you are experiencing the effects of that. So just having an awareness that of the way you're behaving, and that you know it's communicating inner tension and you know it's generating pain, is not going to change anything. Since we are living with this disorder, we need a practice that allows us to live pain and symptom-free. This practice needs to become a lifestyle that helps us communicate consciously and subconsciously to our nervous system energy that is open, allowing, balanced, flexible, and aligned. That's the quality of the energy that we're communicating. Again, that is our job. Our work is communicating this open quality of energy to our nervous system, period. This work is much more efficient and effective when it is a way of being and not looked upon as a temporary treatment to fix a problem. So, the three-pronged lifestyle approach. Number one, you must incorporate think psychological. You must start here, and it cannot be a casual awareness approach. This is acceptance, confidence, and complete trust. When you communicate that with conviction, those qualities to this disorder, you will defeat the subconscious distraction strategy. When you don't, you are living in TMS hell. So number two is think clean. Identify how you are generating inner tension and repressing emotional energy with your thoughts and behaviors. We must learn to stop repressing emotions with our behaviors and our thoughts. This is the transforming therapy that changes this disorder. Chronic overweight people eat to repress emotions. Behaving and thinking in worry, perfection, controlling, striving, pleasing, and holding stuff in is how TMS people repress emotional energy. Remember, having the awareness that you are generating inner tension doesn't change the fact that you are generating inner tension. And it doesn't change the autonomic nervous system's process of producing the symptom effects. So number three is incorporate an alternative therapy to help complement think psychological and think clean. And so what this means is begin a practice of journaling. Use guided imagery. Incorporate a daily waking, working mindfulness into your life. Use the root lock practice, hypnosis, a yoga program. Schedule a personal consultation with me or have a session with your therapist or some other type of spiritual practice that you can engage in. Engage in something or someone to help bring openness, balance, alignment, hope, and guidance into your life. This should supplement, it's going to complement the think psychological and think clean practices. The key here is to engage in all three of these practices as a way of living and not as a treatment. All of these practices are communication to your nervous system that affects positive transformation within this disorder. Again, this is big, huge to understand. When you take a casual approach to reversing TMS, you get casual results. When you make the decision to change your inner communication on an ongoing, this is the way I live basis, and not as a temporary treatment, you have shifted the entire healing dynamic within this disorder. This is the efficient, effective, and the most permanent means of reversing your symptoms and living with TMS. So I hope that you are inspired to live with TMS and live free of symptoms, because that is a choice that you can make right now. So I encourage you to do a couple of things. If you're not familiar with this program at all, I encourage you to begin the master practice. You can go to runningpain.com. There are 4 different options there that you can begin with. If you're on this path and maybe you're stuck or you're searching, I encourage you to schedule a consultation with me. You can turn this disorder around in a 30-minute discussion. It happens every single day. So I hope this was helpful for you. Please feel free to email me questions, to call me, and begin to incorporate this lifestyle approach to living with TMS and reversing the symptoms. Thanks for joining me today.